There is a lot of concern around heartworm resistance, especially as more of us travel with our dogs, and rescue organizations have networked across the country, introducing heartworm positive dogs into areas of the country that traditionally did not have as heavy of a burden. While resistance is a real thing, the first thing to remember is that the vast majority of heartworm positive cases are in dogs that were either not receiving preventatives or there was a breakdown in the prevention program. For instance, a dose was missed, timing was off, or the dog threw up the preventative. This is why it is vitally important to have your dog on a reputable heartworm preventative and to give it according to schedule. Just like we see with bacteria and antibiotics, parasites and pests can become resistant to the drugs we use to control them. There is concern that in certain parts of the country, we are seeing resistance to our preventatives. A couple of important points to note. This is not a widespread problem, and the preventatives we have available continue to be effective in most cases. There isn't one brand or one way of administration that is shown to be the culprit in this. Every product available has had some evidence of issues, albeit small, in the studies that have looked into the resistance issue. Using the preventative correctly is still the most important step in the process. Mosquito control needs to be a tool in high-risk situations. This might include things like eliminating standing water, avoiding peak mosquito areas during peak activity, air movement with fans in kennel settings, and repellents. Annual testing, even for dogs on year-round prevention, is the gold standard. At the end of the day, even with doing everything correctly, if you end up with a dog that is positive for heartworms, it is important to work through the program with your veterinarian. If resistance is suspected, the University of Georgia has an algorithm to help sort out the best course of action for these affected dogs.